Hello, my name is Dawn. I'll be your nurse today. Will you discharge, nurse? May I get your name, please? Your name is Amy. Okay, Amy, let me check your armband. Okay, it's Amy. And let me wash my hands. All right, Amy, I'm going to be giving you some important information to follow while you go home, okay? Is that okay? Okay, Amy, I'll be going over some discharge information with you. There's going to be some do's and don'ts of what to look out for in case of an emergency. Please don't allow anything inside your vagina for 6 weeks, meaning tampons, sex, douching, things like that until you're cleared by your provider, okay? All right. Putting nothing inside your vagina will help you avoid infections and trauma. You can return to your normal diet and activities. The provider listed no restrictions, okay? Just don't overdo it when it comes to your activities. The vaginal laceration that occurred during your delivery will be a little sore. So use a parawash bottle that we gave you as needed for any, going to the restroom. Wiping yourself down there is going to be painful, so gently pat that area dry with toilet paper. If you're really uncomfortable, they say just buy you some witch hazel pads. They're going to help decrease some of the discomfort and swelling that you're going to have. And please follow up with your midwife, Michelle Owens, in 6 weeks, okay? Okay. Okay. And now, Miss Amy, about your medications. The provider prescribed you Tylenol and Motrin to help ease any pain and discomfort you may have. With the Tylenol, you're going to take 650 milligrams every 6 hours. And you can alternate it with 600 milligrams of Motrin every 6 hours as needed for your pain, or you can take either or. Continue taking those prenatal vitamins until your follow-up visit and let the doctor tell you otherwise. And then you also have DocuSafe Sodium, 100 milligram capsules as needed for constipation. You're going to need it to help with that area down there. Take these caps to take your DocuSafe to keep your stool soft and to prevent any kind of straining. It's going to help with the discomfort down there in the laceration area as well. It's going to take time for your bowels to return back to normal, so the stool softeners is going to help you. An important note though, call 911 if you have any difficulty breathing, any seizure activities, or chest pains. Try to keep someone close during your healing period to notify somebody immediately if anything seems out of normal, because if you're having seizures, you probably can't call 911. So call a provider if you have any signs of infection, such as a fever, 100.4 degrees or higher, pain while passing urine, chills, problems with pain not going away or even getting worse, kind of like flu-like symptoms. Call the provider if you're feeling very sad or low mood, because it can be an onset of postpartum depression. We don't want that to happen. Call the provider if you have a sudden large amount of blood coming out down there, something that's not normal at all, or you bleed through more than 1 or 2 pads in an hour. If you're passing clots bigger than an egg size, something you can hold like that and flopping in the toilet or in your pad, your hands are swelling up, your eyes are getting swollen and puffy, your face is getting swollen and puffy, you're having a severe headache, or even your vision changes like out of the norm, it's very blurry, you can't see. You have a foul smell. You know when it's foul, out of the ordinary, foul smell discharge, unable to pee, call the provider like immediately. Okay, Amy, I'm going to teach you what postpartum hemorrhaging is, and this is also known as severe bleeding. Some bleeding is expected, but this is a severe bleeding that you're going to get after childbirth. And you can bleed for up to 12 weeks, but bleeding varies, and bleeding for 12 weeks is normal, but I'm talking about the out of the norm bleeding. Bleeding can happen in women anytime after childbirth. It can occur in women with or without risk factors. Women that are at risk are women who have multiple pregnancies, are pregnant with multiples like twins, triplets, really big babies, a long labor, 8 hours or more, tearing down there in the perineum area during delivery, or previous hemorrhaging during childbirth. Be mindful of the amount of blood because losing too much blood can be very dangerous, Amy. And severe bleeding can drop your blood pressure and it can lead to shock and even death. So watch out for that. Shock is when your organs don't get enough blood and they start to shut down. Postpartum hemorrhaging can be caused by pieces of the placenta, left behind in the uterus, a tear in the cervix, or, bleeding into the tissue that's hidden in the vagina, and can cause a hematoma, like a big blood clot down there. It's a big mass in the vulva area. If you have a clotting disorder, that may cause deep vein thrombosis, with the blood clot in your pelvis or your leg. Pulmonary embolism, which is a blood clot that breaks off and then goes through the blood vessel and leads to your lungs. Or even a bleeding disorder like von Willebrand disease, which is an inherited disease, and it's kind of common. And it's where your blood don't clot, you don't stop bleeding at all. Okay, Amy. I'm going to explain to you the complications of postpartum hemorrhaging, all right? And why it's important to pay attention to your body and when to seek help. Orthostatic hypertension is when you stand up and you have a sudden drop in your blood pressure, you feel like you're about to faint, get dizzy. Anemia is a problem not having enough healthy red blood cells or hemoglobin to carry oxygen through your body's tissues. Hemoglobin is the protein in your red blood cells that carry the oxygen through your body. Anemia can cause you to be tired, weak, have shortness of breath. It can make it very difficult for you to make it very difficult for you to take care of your baby. You don't want to do that. Anemia can contribute to postpartum depression also because it'll be difficult for you to perform your duties every day, so you're going to get depressed. Hemorrhagic shock, which is a form of heavy blood loss, and it will cause your body to shut down. That shock can prevent you from even producing breast milk to feed your baby. It can cause cardiac ischemia, which hurts, which is reduced blood flow to the heart and cause numerous health problems like chest pains, dizziness, heart attack, and even death, Amy. And you don't want to leave your baby behind. Okay, Amy? I'm going to get you to read, but, let me know if you understand what I'm saying. So, do you know what signs and symptoms to look for while hemorrhaging? If you are hemorrhaging? If so, can you repeat them to me? Okay, you repeated them, great. Do you know when to call the provider 911? Can you repeat that to me? You repeated it, okay, great. Can you tell me the meds the doctor prescribed and how to take them, or even if he left any special instructions for you to take? Good, Amy, thank you. Do you know what to avoid during your 6 weeks? Like nothing going in your vagina? Okay, thank you, good. When are you supposed to schedule a follow-up appointment with the provider? Okay, great, you can tell me that. All right, Amy, let's get you and your baby ready to go home. Thank you, nice meeting you.